set up now. I don't know if you heard it, but it's being set up now.
Oh, okay, cool. I just wanted to, somebody ask. Thank you.
Are we waiting for Steve for the meeting to start?
Steve is here.
Oh, have I been speaking all this time and nobody has heard me?
Yeah.
Oh, that's great.
That wasn't bad. That's good.
All right. I'm sorry. Damn it. That's incredible. Okay, so I took the attendance. I'm here. Tanya's here. Sally Fisher is here. Emily Marte is here. I welcomed her to her first meeting, and now I understand why she didn't respond. Jay Mazer is here. We
And Aussie is here.
Osi is here. Great. So we definitely have a quorum. Okay, the problem right now is that I'm being knocked off of my computer for 10 minutes. So the agenda I've sent to the members, but it begins with a presentation.
Steve, we lost you again.
Yeah, I think he really went off for 10 minutes. His computer must be rebooting. I'm gonna put up the agenda so you guys have it on the screen for a couple of minutes while he comes back.
Okay.
I mean, can Steve use his phone? I mean, I know he used his phone in the past for previous meetings. So can we text him and ask him to use his phone?
Yes, we're reaching out to him too.
So is it fair then for us to, does Steve wants us to continue with the agenda?
Steve is back on the call.
Oh, he is, okay.
Let's see what he's saying.
All right, I believe I'm back.
Yes, you are.
All right, well, hopefully this computer won't act up again. All right, so good. Have you just gone through the agenda so everyone got a chance to see it?
Yeah, we saw it.
Okay, very good. All right, so as I think I was saying earlier, Dr. Gordon is kind enough to visit us every December and give us an update about the status of HIV AIDS in our community. We do this in December in observance of World AIDS Day. He is the medical director of the Comprehensive HIV Infectious Disease Clinic at the hospital. At least he was last year when he visited us. Maybe he's since been promoted, which I believe he definitely deserves to have been promoted. But I'm going to assume at this point that he still has that title. So Dr. Gordon, we certainly appreciate you joining us once again, and we look forward to hearing from you each year and hearing about the progress that you're making. And we love it when you talk about how you believe we're getting close to conquering HIV/AIDS and possibly eliminating it. So I'm hoping that you're going to talk about that some more tonight.
Yeah, thanks very much, Steve. Can you all hear me okay? Yeah, I'm also having some computer problems, Steve, so I share the pain you just went through. So hopefully my computer will hang in there and I can update you all on what is now the day after World AIDS Day. It's tough to talk about this a little bit with everything going on with coronavirus and concerns about Omicron variants, but I think you're gonna, what I'd like to share with you is really where we are today in efforts to end the HIV epidemic in New York City, and talk a little bit more about why I think it's still possible, even though some of the challenges COVID is putting in our way. Is it all right if I share my screen and I can show a few slides? Would that be all right?
Yes, go ahead. Your sound is a little bit muddled. I don't know. Could it be that maybe you're too close to the mic? Is that a possibility?
Perhaps. Is this better or worse?
No, I think it's better.
All right. So what I want to talk about is that 7 years of an Ending the Epidemic initiative in New York State and New York City has really resulted in marked decreases in new HIV infections in New York City, large increases in the number of individuals who are receiving HIV prevention services like PrEP, and the realistic possibility of ending the AIDS epidemic in New York City in the next few years. There was hope that we were going to reach sort of a point at the end of 2020 where new cases sort of equaled those individuals who were passing from older age with HIV, and so that the epidemic would not be growing, it would actually be contracting. COVID sort of put a wrinkle in that. If you take a look on this next slide, I'm sorry, the slides look a little washed out, but the star in the upper area here is the Columbia NYP campus. And these round circles are the numbers of new infections or new diagnoses of HIV. And the point this slide really tries to make is that Community Board 12, the hospital, sits in amidst communities with still some of the highest levels of new HIV diagnoses and new infections in New York City. Fortunately, 2 years ago, I think I mentioned this, New York Presbyterian included an HIV and the Epidemic Initiative as part of its 2020 community service plan. And New York State has kind of rolled back the target to 2025 to try to end the epidemic. And NYP is really working assiduously to achieve that goal through investing in HIV testing, linkage to care services, and referral to HIV prevention services like PrEP. And we feel, and I think it's just because of the size and the location of NYP throughout New York City, if we're going to end the epidemic of HIV in New York, NYP can really play a unique role, and I think it really has sort of risen to the challenge. I think one question as you're talking about ending the epidemic is asking the question about where new HIV infections come from. And on your left, this is from 2016. It really hasn't been updated. It was a study that looked at what percent of new infections of HIV came from different sources. And fully about 38% of new infections were thought to come from individuals who didn't know they have HIV, i.e. they had not been tested, so they never had the opportunity to become engaged in care, and through taking antiretroviral therapy, have undetectable viral loads and therefore not be able to pass on infections to new individuals. Another 43% knew they had HIV, but weren't in care. And the bar graph on the right is from New York City from 2019. And you can see out of 91,000 individuals living with HIV, almost 23,000 individuals are out of care at any time. And when they're out of care, they're not able to afford themselves of the life-saving potential of HIV medications, which not only help keep individuals healthy living with HIV, but preclude them from passing the virus on to others. 20% were in care, but not virally suppressed. And so really the focus for ending the epidemic in our communities is to really get everyone tested so that everyone who is HIV who might not know their status knows their status, and then help link people back into care if they're lost to care. So I think I presented this 2 years ago. The community service plan of NYP is working with all the NYP system hospitals now to increase HIV testing, increase ability to refer people, not just for pre-exposure prophylaxis, but a whole suite of sexual health services. And one of the ways we're doing this is with a very innovative real-time outreach dashboard, which of the hundreds of thousands of people who touch the NYP care system, we're able to monitor in real time individuals who are touching the institution who might be out of care, and dispatch care coordination teams to try to encourage folks to get back into care. And we're collaborating with local CBOs and local service providers in this effort. And back in 2015, I think, Steve, when I first started talking to the committee, we were just launching the HIV prevention program at NYP at that time. And, over the past couple of years, over 3,500 people on just the Columbia campus have been assessed for HIV prevention services. And over 2,000 individuals have been prescribed pre-exposure prophylaxis, and about 2,000 are currently on them. And to put that in perspective, we care for about 2,400 people living with HIV at the Columbia campus. And that means now fully almost as many people without HIV, but who are at risk for HIV, are now getting prevention services at the NYP Columbia campus. So a total of about 4,500 individuals. That sounds pretty good, but actually the number of people who we think are eligible for prevention services is about 5 times that number. So we're reaching about 20% of the individuals that we're hoping to reach. I'm sorry, this doesn't really probably project as well, but on your right-hand side, I really do apologize. My computer is, something about the video card is not showing this correctly. This represents a single day on the Columbia campus with about 25, 30 people touching the emergency rooms, the clinics, the dental clinics, and other areas of unknown engagement status with HIV. And we have a pilot now who looks at this, and we're rolling this out to all the NYP campuses, and we're able to respond in real time so that we can really seize the opportunity to get people back into care who might be living with HIV, who've fallen out of care. This shows you the new infections in New York City drifting down from over 2,000 a year to about 1,200 in 2019. So over a course of 5 years, you could see that the new infections were cut almost in half. And if that trend was to continue, you really would be in a situation where there were virtually no new infections, and then over time, we would in fact end the HIV epidemic. Unfortunately, COVID threw a wrench into this, and we have reason to believe that new infections may have risen in the last year. And the work of ending the epidemic has probably been pushed back a couple of years because of continuing disruption to the general care delivery system in both our neighborhoods and the city writ large. One of the new things that have developed from NYP is we wrote a HIV prevention grant and was awarded it from the CDC. And this will increase our ability to do HIV testing in all the emergency rooms and ambulatory practices and navigate individuals at high risk for HIV to prevention services and those newly diagnosed to HIV care. The outreach dashboard that I just showed you will help in this, and part of this grant is to expand this activity to 6 of NYP hospitals, not just in Manhattan, but in Brooklyn as well, in Queens. I think I spoke about a mobile medical unit, which the Dalio Center at NYP has graciously agreed to fund, and we will be rolling out the mobile medical unit, which will offer street-side HIV testing and low threshold access to both HIV care and prevention services, hopefully in the next 4 to 5 months. There are some complex regulatory issues around ensuring that it's Article 28 compliant, but we think we're getting close to that. And as part of this grant, we have a very robust social media outreach program that will, in addition to making individuals aware of the services that are available free of charge, also provide access to at-home HIV testing for individuals at risk, but not accessing care on a regular basis. This proved to be quite potent during the lockdown of COVID-19, where our sexual health clinic was the only clinic that stayed open in New York City throughout the worst days of the early epidemic in February, and March, and April. And many people availed themselves of home HIV and STI testing through our program at that time. So these are some of the high impact HIV prevention services that this grant and other monies that the hospitals made available and other grants have provided to help achieve the end of the epidemic. And I've mentioned many of these, but the care coordination services, I think, are particularly important. We often talk about access to care providers, but I think what we've learned, and I think has probably been appreciated for some time, is many of the complex care coordination services are really the critical linchpins of helping achieve access and engagement for these services, including partner services, care navigation, benefit navigation, social determinants of health assessment and service referrals, patient-centered medical home services, health home services, and referral to syringe exchange programs and safe injecting facilities, which has been all in the news the last couple of days, we think is also an important part of this, as well as access to HIV prevention clinical trials. Since I last spoke, on the right, I again have this multi-campus initiative that's part of NYP's community service plan, which is going to be helping knit together all these services and really push them out into the community. On the left is really all the new resources since I last spoke. And I think this is an incredible testimony to how many new programs are coming online by virtue of many of the faculty at NYP identifying new sources of resources to apply to this effort. The community service plan, which I just mentioned, is funded solely by NYP, and it's supporting a program manager and 7 care coordinators. The CDC HIV Prevention Grant that was recently awarded is also supporting a number of positions at home HIV testing and the social media and education outreach. NYP was awarded an HIV data to care, it's not supposed to be date, but data to care grant from the New York City DOH, which again uses access to all the information systems at the hospital to try to identify and engage individuals who maybe have fallen out of care that would benefit from additional care coordination support. The deployment of the mobile medical unit, which was made possible by both the Dalio Center and a business plan that's working its way through the hospital and we expect to be funded, will result in a new nurse practitioner, technician, care coordinators, and drivers for the MMU. We were awarded an NIH HIV dental grant, which is going to roll out HIV testing, offer, and assessment for prevention services in all the dental clinics at NYP and also Health and Hospitals Corporation dental site. So again, I think this is pushing these services out to places you might not expect HIV services to be, but has got to be part of the strategy if you're going to help identify and engage everyone living with HIV who may or may not know their status in New York City. And then on the horizon, it looks like Gilead, which is a pharmaceutical company that produces a number of HIV medications. They have a public health arm called Focus. We believe they're going to award the hospital a new HIV prevention grant in the next 2 to 3 weeks, which will be focused at the Queens campus. New York City Department of Health is ending a number of their HIV prevention grants and have offered a new opportunity called Replace Your Network 2.0. And NYP has just, in the last few weeks, submitted a grant, which if fully funded would bring in about $2 million a year of services to our campus and the 68th Street campus. There are some other grants on the horizon from HRSA, which we're in the process of evaluating and planning to write and hopefully be awarded and deploy the services. So that's really my presentation for tonight. And I guess I'll open it up for questions, but I think the message that I want to really convey is that even despite the shutdown of a lot of services during the worst months of the COVID epidemic, HIV care and prevention services have remained largely open and have expanded. And while it's completely understandable that much of the sort of concern of the medical care delivery system is around COVID-19 as it should be, we're trying to keep awareness high that we were on the path to ending the HIV epidemic, and if we can kind of regain some of the focus through some of these programs, I think we will achieve it. We did not achieve it by the end of 2020, but the new goal is to achieve it by 2025. And I think we're well poised to realize that goal. And I've always appreciated, Steve, the offer that you've made on behalf of CB12 to work more closely to popularize some of these initiatives that we've talked about. And, we would like to explore ways to do that, because having the services available is great, but we really want to try to get the word out, because it's, I just saw a patient earlier tonight who lives in the neighborhood and had never heard about the services and, is currently HIV positive, but was not 2 years ago. And that individual was a perfect example of someone who would have benefited from the access and ability to access HIV prevention services. So there's a constant reminder with new infections of missed opportunities. And we really want to see if we can reduce that farther in pursuit of the goal of ending the epidemic, but also obviously on the individual level, we just don't want to have any more missed opportunities if we can. So I'll stop there. I apologize that my slides look all washed out. I will update my media card on this laptop, but that might be for next year before you get a clear presentation from me. Any questions about anything that I brought up?
I have a couple of questions. Do you want to take it down from the screen first?
Oh, yeah, sure. I'm sorry.
All right, very good. Well, first of all, I think we would certainly be interested in helping you promote the mobile medical unit. once that's out on the street. That seems like a particularly good effort to reach people who otherwise are not going to come forward and come into the medical center itself. So I think we would certainly want to help you in that effort and anything else that you have in mind. My first question is, you mentioned earlier that 25 to 30 people are coming into the hospital on any given day with HIV. Are these people who have not previously been diagnosed with HIV that you're finding out when they come into one of the clinics or availing themselves of one of the other services, that in fact it turns out that they do have HIV? Is that what you were saying?
Yeah, no, what that was showing was many more people than 30 people a day are touching the institution living with HIV. But those are individuals that there's no evidence in these big electronic systems of care engagement. So they look to be out of care, and they may be touching a clinic for rheumatology or touching the emergency room. And over a course of a year, it's thousands of people. And what this dashboard does is kind of alert our HIV program, our care program, that a person living with HIV who looks, at least on the surface of things, to perhaps be out of care and not receiving medication is touching the healthcare system. And it's an opportunity to just say, hey, do you need help getting back into care or getting medications? And you might say, well, gee, that's a little invasive, but if it's done with a light touch and supportive and sort of, with a person's confidentiality in mind, people overwhelmingly are appreciative of the offer that someone is looking to help them get back into care and get medications and get help with housing oftentimes, and food insecurity and other issues as well. So that's what that outreach dashboard shows. And we have another dashboard which looks to see if anyone's ever been HIV tested before, because there's public health law in New York State to offer an HIV test to anyone who's not received the test before. And we have programs in the emergency rooms in particular, and other places where we monitor that, and we have a prompt to suggest that it looks like the person's never been HIV tested before. So consider offering the test as part of the care that you're rendering in that visit.
All right, so these, the 25 or 30 individuals you referred to are people who may in fact have known that they had HIV, may have been linked to care at some point, and then have fallen away, and you're trying to bring them back in.
There's about 100,000 people in New York City living with HIV. About 20 to 25,000 are out of care at any given time. And not only is it dangerous for the individuals, but it's a source of, as you saw on one of the slides, probably about 35% of new infections. So there's a huge effort in New York City and New York State to reconnect the 1 in 4, 1 in 5 individuals living with HIV who are out of care back into care. And there's been public health law change in New York State that's tried to, help promote that activity.
I just have one other question, and then I'll turn to my fellow committee members. Someone has dropped a question in the Q&A asking whether any of this outreach will be provided at the safe injection site that has just been opened up by the Corner Project at Amsterdam Avenue at 180th Street. Are you connected with that effort over there?
Yeah, we've worked very closely with Washington Heights Corner Project and NYRE over many years, and we've at some years we've had clinicians who volunteer in the site. They're, I think, expanding and using some of this funding to crank up clinical activities on their own, but we work very, very closely with them. And we have a walk-in policy, so we're always open without an appointment for people to be brought in who would benefit from medical services. And we do the bulk of the HIV and Hep C care and for them. And we're they were part of our DISREP, NYP's DISREP coalition called REACH for many, many years. So we work very closely, and we're really thrilled to be working with them going forward as they launch on this effort.
All right, let me turn. I have 3 or 4 committee members who have questions. OC, you have a question?
Yeah, I do. Thank you, Dr. Gordon, for the presentation. You mentioned at the beginning that about 20% of individual that are currently with AIDS are really benefiting from that program. Did I get that correctly?
No, what I was saying about 25% of people living with HIV in New York City are out of care at any given time.
Okay.
And
So-
if they touch the NYP care system now, in real time, we sort of know it, and we dispatch a navigator or care coordinator to the site to, in a very sensitive fashion, raise the topic of whether they may or may not be in care and whether they would benefit from assistance to get back into care.
So my question is, how can we reach the 75%? If only 25%, what can the hospital do better to reach a larger number of individuals that can benefit from a care program?
I will say, and I've been at the hospital for 31 years, and Julio, the hospital has been terrific and is committing literally hundreds of thousands of dollars and has been super broadly supportive of us as we write these grants. And I don't think the hospital could realistically do more than they're doing, but we need to do better with outreach so that every corner of every neighborhood knows that these services are available free of charge and non-judgmental, non-stigmatizing, really affirming individuals' autonomy and right to access to care and the availability of care. And so we're really going to try and focus on that. Unfortunately, COVID has been such the elephant, not, and it should be, but we thought that things were calming down, and I think we're launching a whole number of outreach activities, but it's very hard to do outreach. A lot of our CBO partners suspend in-person outreach efforts appropriately when they're concerned about the safety of their staff. And so we're keeping an eye on what's happening with Omicron, and hopefully this will not turn into another number of months where we have to suspend some of our activities.
Thanks.
All right, so Jay, you're up next.
Yeah. My question is that New York City is a world city, and 35 million people have already died of HIV. People are constantly coming to New York who don't have access to the excellent services provided free by Presbyterian. So given that fact, until these services are universal, how is it possible to talk about elimination of
It's a
the
great,
problem?
well, New York State makes a number of programs available to institutions like ADAP, or what's called HepCap for Hep C, or PrEP app for people who don't have HIV but want to access prevention services. We provide services to anyone coming, whether they have insurance or not, through these state programs and through grants that we have. So there is no limitation on us providing either the medications or the services for HIV, for prevention, for Hep C. And we, probably 20% of our patients that we serve don't have Medicaid or Medicaid managed care, are not eligible, but access the services through NYP and our clinics through these city and HRSA programs or grant programs. So we are able to provide services free of charge to anyone.
Yes, I understand. I guess I wasn't clear enough. people from around the world who haven't had access to your excellent services are constantly coming and going from New York and either using drugs or having sex. And given that fact, how is it realistic to talk about ending the AIDS pandemic when the whole world doesn't have the same access to the excellent services you provide?
No, you're absolute. I think you've probably all seen, there's been a lot in the news recently about the lack of a global vaccine response to COVID is going to ensure that we have COVID, endemically for years to come. And I think people are waking up to the fact that whether you're talking HIV or COVID, we've got to change. I mean, it's my personal view is you're right. We need to provide greater access to basic services globally, not just in our city or our country.
All right, there's Sally.
Thank you for your presentation. I look forward to this every year, having lost a brother to AIDS in 1990. The question I have, at one point, the cost of the drugs was the real barrier to people getting treatment. To what extent is that still a problem in New York City? I know you mentioned that at New York Presbyterian, the drugs are included in the treatment, but how widespread is access to drugs?
Yeah, it's we have to do. So we've not had a situation where we've not been able to provide these expensive drugs to individuals. There is work. There's access programs that both the state and the pharmaceutical companies make available. We have over 100 people who work in the program, and a fair number of them are there. Their expertise is plowing through the forms and the prior authorizations to get the drugs for individuals. But you're right, we're able to do that. And the time it takes us at most is about 15 minutes to work through with some of the folks that we have who are really just masters at knowing the right phone number and the right form to use and the right registration and all that kind of stuff. So it's not a barrier for anyone at this point.
Great, thank you.
Tanya.
Yes, hi. Forgive me if you've already answered this question, but can you tell us a little bit about the people who are accessing these services? A little bit more about them, who they are, and anything about demographically.
Sure.
And what are some demographics that you feel need to step up in terms of being able to access or just doing outreach to them? Yes.
Yeah, no, thank you. Of the 2,400 people living with HIV that we serve, 95% on the Columbia NYP campus are Black or Latinx, and about 50% identify as MSM, and 50% probably heterosexual. 40% have tobacco use on a constant basis. 60% have either active or a history of drug use, and over 60% have history or active mental health challenges. In recent years, we started providing Suboxone, co-located, and access to Washington Heights Corner Project, and we have on-site mental health team of 2 psychiatrists, a psychologist, and 6 social workers who are trained in behavioral health and mental health therapy. So it's a population with high degrees of multimorbidity and oftentimes low socioeconomic status, unstable housing, food insecurity, and about 20% of folks were working to try to get a better access to food banks as the winter closes in for folks. So it's a super high needs group. In our prevention group, it's mostly young men of color, with high rates of use of crystal meth and other drugs. And so we're looking at a grant right now to try and provide better methamphetamine treatment services for a young prevention population.
Wow, thank you. Thank you.
Tanya, thank you for that question. I'm not sure whether it came through clearly enough. Did I hear you say that 50% of your patients are heterosexual?
Yeah, so have a history of HIV acquisition through either IVDU or through relationships. Oftentimes, these are, women who were unbeknownst to them in a relationship with, contracted HIV from husbands who, were infected earlier in their lives and didn't know. So about 50 we're different than a lot of clinics. We have a larger percentage of individuals who acquired HIV through heterosexual relationships rather through MSM or IVDU. And it's just a byproduct, I think, of how HIV percolated for many years, decades in Washington Heights and Inwood, and we weren't really effective with outreach with testing, and it established.
All right, Emily, I'm pleased to see that you're not going to hold back and get right into it. So let's go ahead and ask your question. You have to unmute yourself. Emily, could you go ahead and ask your question? Go ahead.
Oh, will he hear me?
Yes, I hear you now, Emily.
Yes, now we can.
Okay. Hi, everyone. So thank you for the great presentation. I was really wondering about this as I'm going to do an infectious disease OSHA funded training, and I was looking at the history of infectious diseases. And I was even wondering myself, like, now that outreach is probably difficult during these times, do you believe, I have several questions. Do you believe there's going to be an surge at some point, like in the future, since people aren't really getting tested as often? And another question is, these efforts that you just listed, they do sound familiar, and I don't know if y'all have already been doing this, but how would we reach out to people that are now working from home or not really out in the streets anymore during the pandemic? Like, don't you think it's still like not enough? Maybe, because I know that every single time, let's say I would go to the clinic or to my primary doctor, I would have to fill out a whole consent form for HIV. Maybe it would just be something that's required now for more places. I'm not sure if maybe that's like a hindrance. So, or not really a hindrance, but just like an extra step. So it's like, it's something that's like required now, just like the whole, like, do you have your COVID vaccine, right? So I was just wondering what your thoughts were on that.
Let me say that you can pop by my office anytime and we can kick back, and I don't mind talking about this for hours. So it's an open opportunity. Just come on in anytime and we can chat about it. New York State changed the law so that you no longer, you don't have to get consent for HIV. When people come in, it's if they don't have evidence of being tested, we sort of inform them that we'd like to run an HIV test, and they can decide to say no, but we assume that we treat it like any other test, and we just inform them that we're planning to send it, and a person can decline it, but it no longer requires consent. In terms of getting the word out there, as part of the recent grants that we've been awarded, we have a very robust social media reach planned. And so hopefully you'll be seeing a lot of that. And I think that offers the opportunity to reach into people's homes and other places and make them aware that, and in fact, we send kits to people's houses if they don't want to come out. And we've got a whole strategy around sexual health services that are delivered either via telehealth or through snail mail, basically. But you sound very interested in it, and we're always looking for people who are interested in this. So you come on by anytime, and I'd love to talk to you more about it.
Sure. Thank you.
Very good. All right, I think that wraps it up. Julio, could you arrange to have the PowerPoint sent to me after he fixes that typo? Then you can send it to me. So I would appreciate so I can refer to it as I'm doing the minutes. Thank you again, Dr. Gordon. Thank you for all your work. Thank you for taking the time out to join us every December and give us an update, and keep doing the good work you're doing.
Yeah, I should say it's a lot of other people. I just am the person who presents it. So thank you all. And thanks for inviting me.
Yeah, you should bring them all with you.
We would fill up your space.
That's okay. They probably deserve some public recognition, and we're willing to give it to them. So we'll wait until we're back to normal and in a regular meeting room, and then you can bring the entire crew. Thank you so much. Sally, is that a new question?
Nope, he got it.
Okay, thank you. Okay, okay, Julio, you're staying with us. You're not going away.
I'll stick around.
Okay, thank you. Okay, we're moving forward now to a presentation from Health and Hospitals, the Gotham Division, I believe it's called, and in particular the Dyckman Family Health Center at 175 Nagel Avenue at Dyckman Street. We used to have some regular contact with the director of that center some years ago, but then she retired. So it's great that we're now reconnecting, and hopefully we'll have a chance to stay in touch. So I think I'm first supposed to turn it over to Donna Cox from Health, who's going to introduce the site administrator, David Caldwell. So Donna, I believe, is with Community Affairs at Health and Hospitals. Is that correct?
Yes, it is. So good evening to everyone. My name is Donna Cox, and I am a community liaison for Gotham Health, part of the Community Affairs team. With me this evening is Mr. David Caldwell. He's an associate director of Gotham Health's Dyckman Family Health Center. I would like to thank you for giving us the opportunity to attend this meeting of your Health and Environment Committee. Gotham Health has been reaching out to community boards across the 5 boroughs in order to raise awareness about the services that we offer, while at the same time we listen to queries or questions which residents may have so that we may improve our services overall. At this time, I'd like to hand over to Mr. David Caldwell, who will make the presentation.
Very good. Thank you. And thank you for reaching out to us. Mr. Caldwell, go ahead.
Good evening, everybody. And thank you for allowing us to be here. My name is David Caldwell, as Donna told me. Thank you, Donna, for the introduction. I'm an associate director at Sydenham, which is the main site for Gotham Health, Dyckman. And I've been here since 2019 as an administrator for Dyckman. And then about 6 months in, COVID hit, and then everything just kind of went crazy for a minute. But it kind of limited our ability to the outreach that we want to do and participate in the neighborhood and the community events. But I'm glad that you guys are happy that we're back a part of the community. And I'm going to share my slides. I have a slide presentation for our sites. So just give me a second. All right, so we are a part of New York City Health and Hospitals, which is a public healthcare system in the country. Gotham is a subsidiary of that. It's the ambulatory care arm of New York City Health and Hospital. So we're part of, we're a federally qualified health center, which was created in 2015 to address primary and preventative care needs for families and individuals in their own neighborhoods throughout the 5 boroughs. So Gotham Health as a whole consists of 6 large diagnostic and treatment centers with 20 plus smaller neighborhood health located and or near high need areas in New York City. So Dyckman is one of those neighborhood health centers. So our goal is to deliver high quality healthcare services with compassion and dignity and respect to all New Yorkers without exception. And we also, our goal is also to promote healthy lifestyles and to build healthy communities, one family at a time. So Dyckman is located at the intersection of Nagel Avenue, which is right across the street from the 1 train. Our hours of operation are Mondays and Wednesdays through Friday from 8 to 5. And then we have a late clinic on from 11 to 7. We generally provide primary care services. So we have pediatrics and general medicine. But we also have laboratory services, point of care testing, and chronic disease management. We have 1 pediatric provider, Dr. Freelander, and then we have currently we have 2 adult medical providers. One is Dr. Cadet, and the other provider is a PA Rivera, David Rivera. And then we also have a public health educator, smoking cessation for our patients that visit the clinic that smoke. So they are referred to smoking cessation, and they try to help people deal with that habit. And we also have a chronic disease nurse that comes 1 day a week to help people that are high risk and have uncontrolled blood pressure or A1C levels. So our staffing, we try to keep our staffing kind of reflective of the community that we are in. So most of our staff is bilingual, English and Spanish. For languages that are not spoken by the staff, we have a system called Syricom that gives us video translation services and over the phone translation services with more than 100 languages and dialects. This provides an optimal patient experience, which helps to improve patient outcomes. One of the things that's extremely important about Dyckman is that it's a federally qualified health center, so it allows us to provide many options for healthcare, regardless of the financial situation of any of the patients that visit or the immigration status. We accept most insurance plans and offer discounted fees on the sliding fee scale for patients who do not have insurance. And then the facility provides an immediate translation services free of any charge to all who have limited English proficiency. So as I mentioned before, with COVID over the last couple of years, it's been really difficult to do the outreach events that we wanted to do. We definitely wanted to participate in National Health Centers Week. We had a whole plan with Metro Plus to set up outside the site, and we were unable to do it because around that time, that's when we started to see a surge in the numbers for COVID. But next year, hopefully we can get back to that, and we can do some outreach, some screening for the patients in the community or the members of the community. And then we're also working on bringing a social worker back to the site. We recently lost our social worker over the last year, so that we can help patients that have needs that may be affected by some social determinants of health. And the facility also fosters community-based partnerships and strategic health solutions. So these are just some comments that I copy and pasted the most recent Press Ganey report that we got. And you just read through it. These are just some of the experiences that the patients have when they come to the clinic. The staff is good, they're motivated, and they're really eager to help anyone that comes in. I think that our visit volume is kind of low for what we would like. And so hopefully just us engaging more in the community, we let more people in the community know we exist and that we have these services to offer for them. But it will be definitely to our benefit to keep, joining you guys in these meetings and just kind of see what we can help and to improve in the community, improve the health in the community. And that's about it. If I'll open the floor now for any questions, if anyone has any.
Well, let me just say again that we would certainly welcome your attendance at our meetings on a regular basis, as often as you can make it, and certainly we would appreciate your input and the benefit of the knowledge that you've gained in serving our community and letting us know where there may be service gaps and where we should be advocating maybe for additional funding from the city. One of the functions, as you probably know, for the community boards is to advocate every year for budget priorities in what for our community as to what services we would like to see funded, and we would certainly welcome any suggestions that you might have along those lines. Can you remove this from the screen so I can see the people in attendance?
Sure.
All right, very good. All right, so we do have a couple of questions here. And Fernando, I see you getting maybe a little nervous. Stick with us. We'll be with you soon. Don't worry.
I'm good, don't worry.
Okay, great. I'm concerned because this is your first meeting. So OC, you have a question for Mr.
Yes. It's actually first I want to say that the testing facility that you guys had was just awesome, beyond awesome. I had many tests in that facility. You show up, boom, 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 20 minutes later, you're done. And the results, for the most part, you get them like maybe 24, sometimes 48 hours later, except one time that I was at the airport. You guys almost gave me a heart attack, but I got the result. But it was really great. And I just wonder why the testing facility is no longer there. I get the outside, it's winter and all that, but is it no longer needed?
Yeah, this is one of the questions that I had early on when Donna reached out to me. So she said that you'd be able to explain to us tonight why the testing facility was discontinued.
Well, I think, that was a decision, obviously, that was made by our executive team, but during a time where the volume of testing, it dipped very low. So we weren't seeing as many people coming for testing as we were in the past. And I'm sure that there was some financial limitations that kind of steered that decision. But then we also have test and trace that have mobile units in the community. So we kind of shifted at all three of our sites to having those the testing be a part of, to have test and trace take over the testing and vaccinations in that area. So we do have, like, test and trace does have mobile units that go through Washington Heights, and they provide testing and vaccination for the community.
Well, we'll get to Fernando soon, and I'm sure he'll be able to fill us in on the mobile units. But what's the chance of now, instead of doing testing, doing vaccinations? Because we're still lagging behind in this community on vaccinations.
Well, I can definitely I can take that back to my leadership, see what we can do. Obviously, with the spacing that we have in the clinic, we don't, the clinic is a small clinic, so we dealing with the capacity of people that will be coming to get vaccinated. It will be kind of hard to do with social distancing inside, and then also trying to accommodate our patients as well. But it's definitely something that I can bring up. It's a possibility that we can have a mobile testing unit sit outside the facility. That's a possibility. But I'm not sure. That's something that we would have to kind of discuss with test and trace.
Yeah, I wish you would because right now that zip code 10034 has the lowest percentage of people vaccinated in our community. They still haven't reached the 70% threshold. So there hasn't been a continuous vaccination site in that community, apart from maybe the drugstores. But it would be good to see the city provide something. And we, in fact, at the community board, passed a resolution now, I guess, 2 meetings ago, in which we called upon the city to open up a full-time vaccination site in Washington Heights and Inwood, and to pay particular attention to the need for some presence up in Inwood. So if you could take that back, I'd certainly appreciate it. You are the one city-run facility that we have.
Area.
I mean, apart from I think we still have a child health clinic at 168th and Broadway, but apart from that, that's not there either. So you're the only city-run presence we have in all of Washington Heights and Inwood. So we really would love to have you be more active and to help us out with our efforts to try to get people vaccinated, especially I think at this time. So would appreciate that. Sally, you have a question?
Yes, you mentioned that volume was low. What is the current volume and what kind of services are people being treated for? Like any data you have on utilization that you could share?
Yeah, we complete probably an average of maybe like 50 visits a day, or less. It could be lower than that. That's between the 3 providers that we have there. So we have peds patients, just primary care services. So majority of the patients that we have suffer from like chronic disease that we're trying to manage.
And what are any demographic data that you could share?
Yeah. So, I mean, what do you want, like age, like that?
Age, ethnicity, etc.
Yeah, so probably 2/3 of our of the patients that come to our clinic are Spanish speaking. About 40% are between the ages 27 and 54. Another 40% are 20% are 27 and under, and then 54 and up is another 40%. So that's about the age. I don't have the data on the ethnicity though.
Okay, and then you mentioned that obviously volume was impacted by COVID. Now we're looking at another surge in COVID because of the new variant. What plans are you making to sort of get ahead of that?
Right. So, I mean, I have discussed that. We've talked about that's the reason why I said it. It's not, I don't want to get your hopes up about it. It's just something that came up in conversation with my leadership about trying to have like a mobile unit that's stationed outside of the clinic. But that's kind of a decision that's outside of me, but that's something that we've talked about. So we have done that at other sites. I'm not sure what had to be done to get that, to have that in place. I know right now there's a lot of priority on the schools and the children being vaccinated. So most of the mobile units are going to the schools for a couple of weeks, but you know, it's something that we've been talking about.
All right. Well, we certainly look forward to hearing the results of those discussions, and to the extent that you might be able to expand your services. What you said, Judge, in answer to Sally's question, was that the average is 15.
No, 50. 50.
Oh, thank God. Okay, very good. All right, 50 visits per day, split between the 3 providers. All right.
And then also smoking cessation visits and lab visits. People come for the lab to get their blood drawn. So that's all included. Nurse visits, people come to get vaccinated. So that's all included.
All right, that's great. Well, again, I extend a welcome to you to come back anytime you want. Whenever you feel as though you have something to report to us. You know, at this point, we have all the major health institutions in the community coming to us every single month. If you want to be on that in that lineup, I would welcome it. And certainly when you should feel free to come to us on some kind of semi-regular basis. And it's
Yes, please send me the invite each month. I'll definitely be there.
okay. Well, I'll tell them to add you. Paola from our office, assistant district manager, is on the call, and I'll ask her to include you on the mailing list so that you will get notices of all of our meetings.
Okay. Thank you.
All right. Well, thank you. All right. We're going to move on now to our COVID-19 section of the meeting, and I'll give a quick update on the latest statistics that I took off of the Department of Health and Mental Hygiene website today. Shows that our community is considered to have a substantial transmission rate. A month ago, when we last met, we had a moderate transmission rate of 37.11 cases per 100,000 over the previous 7 days. Now we're up to 67.09, almost twice as many as we had last month. And yet, we're still far below the rest of the city. The rest of the city is at 125 cases per 100,000, and Manhattan is at 122. So even though we have a substantial rate, somehow we're far below the rest of the city and the rest of the borough. Since we last met, 545 new cases in the 4 zip codes, and 4 more people have lost their lives, have died from this pandemic. As I mentioned earlier, well, I didn't quite go into it, but 3 of our 4 zip codes now have at least 70% of the residents have had at least 1 dose. The zip code 32 is doing the best at 73.38%, and zip code 34 is at 69.71. Still has not reached the 70% level. And again, this is significantly below the rest of the city, which is at 77, and the rest of all of Manhattan is at 86%. So that's where we stand at the moment. Let me now recognize the Manhattan Community Liaison for the Health Department, Pauline Ferranti.
Hi, good evening, everyone. So, Steve, your meeting is very timely because had we met yesterday, I would have said that there were no cases that we know of Omicron variant in New York City. However, as many of you may have known or heard on the news, that the governor and the mayor had a joint press conference stating that there are now 5 cases in New York State. So there's 1 in Suffolk County, 2 in Queens, and 1 in Brooklyn. And then there was a case of that traveler who went to the Javits Center for an anime convention. So probably in contact with a lot of people. And they went home to Minnesota, I believe, and tested positive for the variant. So, you know, there is high transmission across the city, but the good news also is that we are seeing vaccination rates increasing. But again, you know, we are encouraging everyone to go and get your booster shot. Now, everyone over the age of 18 is eligible to get a booster. If you received the Moderna or Pfizer vaccine, you are eligible if you've received it at least 6 months ago. And if you received the J&J vaccine, if your dose was at least 2 months ago, you're now eligible for a booster, and you can mix and match doses if you want for your booster. So it's definitely something you want to talk to your primary care physician about if you're thinking about getting a booster of a different brand of your original vaccines. It's still recommended to stay with your original, but if you are interested and you talk to your healthcare provider, it could potentially be an option for you to get a different brand booster. So those are like the pretty much top line updates for today. I'm happy to answer any questions. And actually, I just wanted to touch base quickly from the last meeting about specific data for NYP. And I don't want to put Julio on the spot, but I did reach out to our team, and we don't have like that specific data. So what we capture mostly is zip code, but I don't believe we have like the specific, like where the person was received their vaccination, and we don't have like hospital-based information about cases and, you know, people who've recovered, for example. So I believe, you know, from the leadership perspective, that if that information is requested, it should be provided by that specific hospital. Again, I don't want to put Julio on the spot, so I apologize for that. But that was the information that was relayed to me. So I just wanted to make sure that I addressed that question from last month. And then if there are any new questions, I'm happy to answer them.
I don't think I have anything. I'm gonna have to call you separately because I'm having trouble finding the positivity rates on the website.
Okay.
We don't have to deal with that right now.
Yeah, please call me. Oh, also some like related but unrelated updates. You would probably know that our former commissioner, Dr. Mary Bassett, is now the commissioner for State Health Department. And then also Dr. Cunningham, whom you all met last month, is now the commissioner for State OASIS. So I know there might be some questions about the Overdose Prevention Center in Washington Heights. So I can hopefully answer maybe some of the questions you have, but I am not the expert in this particular field. But we do have someone who took over for Dr. Cunningham. His name is Dr. Michael McRae. And I'm more than happy to schedule some time for him to come to speak to the community about OPCs in general. And then of course, Steve, you know that the Washington Heights Corner Project will be the operator of the OPC here in Washington Heights, and they will be the best in terms of providing information about their operations. And to my understanding, I saw a question about how they're funded. To my understanding, they're privately funded. And so the city doesn't necessarily have any funding or, you know, operational role in these OPCs. So I just wanted to clarify that also with the group here tonight.
Actually, I'm really glad you brought that up because I would like to have a full discussion with the Corner Project at our next meeting, and it probably would be very helpful to have. Did you say his name is Dr. McRae or her name?
Yeah, Dr. Michael McRae.
Yeah, so if you could arrange perhaps to have him come to our next meeting. I'm not sure what the date is at the moment, but hold on a second. It should be January the 5th. So we can be in touch with that. But I think in light of the latest development and the fact that the safe injection site has now opened up, it'll be worthwhile to have a full discussion, and we'll have the benefit of seeing how it's been in operation for a month and to see if it's had any particular effects on the surrounding community. So yeah, it would be great to have a discussion next month.
Sounds great.
I assume they do get some governmental funding. I can't believe it's all private, but I guess we'll find out. Sally, is that a new hand?
It wasn't, but I guess I'll ask a question. The other two sites that are being looked at for the overdose prevention centers, I guess one was Housing Works. Is there another one, and how quickly should we expect those to come online?
Yeah, so actually so Housing Works is one location, but the two that are now able to operate is the Washington Heights Corner Project and the one in East Harlem that is operated by NYRE. So those are the two that have been approved for operation this week, I think as of yesterday. And
we don't know how quickly the other two might come online?
We don't. And I believe there are a few sites in the Bronx and potentially in Brooklyn that may open up over the course of the upcoming month.
Okay, thank you.
I think some of the concern obviously is that, people may flock to the center in Washington Heights because it's one of only two that's currently open. So to the extent that maybe others open up, that might relieve the pressure on this particular site. But again, I think by next month maybe we'll have a better sense of how it's working out.
Yeah, absolutely. I think research has shown that people do not travel very, very, very far. So potentially it won't be the case where people will flock to the Washington Heights or East Harlem location. But again, New York City is very different than where these other sites currently exist, which are mostly in Europe and in Canada. So yes, I think we will be able to see, next month sort of how the operations are going, and to any extent that the agency can be helpful in mitigating any concerns, that we are very helpful, very willing to be able to provide any assistance in that regard.
Right.
Pauline, it would be very helpful to bring in some information on the incidence of substance use disorder in our neighborhood, because there's a lot of bad information and misinformation out there.
Yeah, absolutely.
Social media has been going nuts. I can't even look at it anymore.
Yeah, there's so much misinformation out there that it's a little bit frightening. And I think, the ongoing conversation around harm reduction and overdose prevention needs to continue in the city. And I think, if you have any ideas about how we can do a better job getting the correct information out, we would be very happy to receive that information.
Great, I will spend some time looking at that.
Thanks, Sally.
Very good. All right. Thank you very much. And thank you for your loyal attendance at our meetings.
Yes, always happy to be here.
Thank you so much. All right, Fernando, it's your turn, believe it or not. Very happy to have a representative again from the Test and Trace Corps. Fernando Brigitte, if I'm pronouncing it correctly, is the Manhattan Outreach Director for New York Health and Hospitals Test and Trace Corps. Fernando, tell us what you're doing in our community.
Hi, everyone. Thank you, Steve, and thank you, everyone, for the invite. I joined the Test and Trace team, specifically the outreach team, on November 1st. So I'm now introducing myself to the community board meetings in Manhattan, and I'm happy to be here tonight. I have some slides, some of the things you already covered, actually, and then Pauline touched on some of them. So if you want to guide me on what you want to focus more, I'm happy to do that. Let me open my PowerPoint here.
Go ahead. This could be a record for this committee. 3 PowerPoint presentations in one night.
Can you guys see my screen?
Yes.
Cool. So just really quick, an overview about where we are in terms of transmission. This was updated this morning. Overall, Manhattan is doing better than the rest of than the other boroughs. We see good rates here, and then you see in another slide that this is very much closer to a combination of high testing, high usage of masks, and high level vaccination rates compared to other boroughs. Overall, based on our data from today as well, 98% of cases are still the Delta variant. Like it was mentioned in the next hour or so, the next couple hours by the mayor, the Omicron variant was just identified. But as of right now, it's still the majority of our cases still with Delta variant. About Omicron, really quick, this was just, it changed the last 2 hours, like I said, but Delta is still the dominant strain with 98%. There's still a lot that is unknown about this new variant in terms of how transmissible it is, the severity of the cases. So there's still a lot of studies underway. When we have a new variant like that, our message is always to remind people and emphasize that we need 3 things: vaccination, masking, and testing, all of them combined. We know that the number of tests lowered a little bit in early fall, and it's important to remind that especially now that we're getting like family getaways, we're traveling more than earlier in the year, it's important to get tested before and after. Our mask advisory, it's recommended again to wear mask indoors in public spaces, or if you're in a gather inside with a significant group of people, it's important to go back to wear masks. So our message is, and we're going to be focusing a lot more specifically at my team, the test and trace team, the outreach team, to also get tested, even if you're vaccinated, get tested before traveling, after traveling, like I said, when you're meeting people. Now there's holiday parties or holiday events. It's important to consistently get tested so we can trace and identify our positive cases and know where they are, and as much as possible, isolate them. I'm gonna go through this part a little faster. We have some resources that I can send by email in case people don't know. The vaccine finder, the testing finder, where to find a test near your zip code. There's also the possibility of in-home vaccination for people that are 12 and older. And if some people is concerned about the vaccine, has some questions and want to hear from an expert about sometimes maybe the kids vaccine or even for adults, we also have a phone number that they can call and ask all the questions that they have, bring all the concerns. But overall, it's important to remind people, vaccines are safe, they're effective, they're the life-saving tool that we have. And again, they're strongly recommended. Even if you had COVID recently, you just have a wait period and then you should get your booster or get your first shot if you haven't. And as a reminder, always important to emphasize the vaccines do not contain the virus and they do not alter your DNA. About a vaccine for children that was recently approved. So from 5, not only 12 to 17, but 5 to 11. It's also a two-dose vaccine. So take one now and then after 3 weeks or 21 days. And the resources I'm going to send you all as well about where to find them or how to schedule. The boosters and third doses, boosters are available for all adults 18 and older. I think Pauline mentioned that already. 6 months after Pfizer, Moderna, and 2 months after J&J. And nobody should be turned away if they qualify, if they have after those months since their last shot. About the city, a little bit where we are. So more than 12.5 million doses administered as of today, as of this morning, and 5.79 million New York City residents or New Yorkers fully vaccinated. In terms of vaccine, I think this is maybe blocking a little bit. Overall, Manhattan is doing, like I said, better than the rest of the city, and then the 7 corridor in Queens as well. And then we got some good improvements here where Community Board 12 is located. We still have work to do, but it's like Steve mentioned, is still in a good place compared to other areas. Citywide, the vaccination rates for children specifically, I think it's important to bring because it's something new. We got a really good jump in basically 1 month with at least one dose, 45.5% of children vaccinated. So this was a strong push from the city with partnering with the Department of Education and partnering with community-based organizations to both spread the word and help us with scheduling of mobile clinics and also help us with locations. So this was something that we're very happy that we're able to reach and we'll continue doing in the next few weeks and months. I want to touch a little bit also about specifically our referral program, which is something that was launched by the mayor in June of this year, in which, as a reminder, or maybe it's new for some members here, organizations receive $100 for each first dose that a patient that referred that organization, in addition to that $100 that the patient themselves receive, if that vaccine was given in a city-run site, including schools or including the vans and the buses. The program was just announced recently that it was extended, is now extended until January 31st. And we hit more than 50,000 referrals, which means that community-based organizations and PTOs and PTAs will receive, will split $5 million, and we have a total budget of $7 million. So there's still another 20,000 referrals that we're going to be given in the next next couple of months. And specifically, we partner with schools, as I mentioned, to help us with the vaccination for kids. And 12,000 of those referrals that I mentioned, of the 50,000, were from school-affiliated organizations. We know how much schools were impacted by COVID last year and this year, really. So we saw that it was a really excitement that we're doing vaccinations inside schools. That gives access to basically all areas of the city. And it's a place that kids are already used to going. It's a familiar space, it's a familiar environment. So we thought that gave us some really good results. A few things that I like to mention that were discussed, just like going back to the positivity rate here in the area of Community Board 12, in Inwood 2.81, the north side of Washington Heights 2.4, and the south side of Washington Heights 1.28. And again, it goes along with, like, as vaccination rates are a little higher, the positivity rate tends to be a little lower, as long as we're, again, using masks and getting tested frequently. I guess I'm gonna wrap here, and then we can go for some questions about mobile and about testing and about vaccination, the mobile clinics and vaccination sites.
Thank you. And I guess I should have mentioned this also to Mr. Caldwell. I would appreciate it if you could forward the PowerPoint to me so I can I could cull some information from it for our minutes. I guess my question would be that I would like to set up a better system for by which we would get notified of the mobile vaccine and testing sites, so that we could publicize them through our community. And so we could do email blasts. I would like to have the community board help to promote the work that you're doing. But we don't seem to really get notified of them, of these. We seem to find out about them sort of haphazardly, second or third hand. So it would be great if we could get notices from your office directly once you set them up, so we could quickly do email blasts and send it around to the community.
Yes, absolutely. So what we've been doing so far is we have thousands and thousands, literally, community-based organizations who are partners from the program. And normally when we have a van or a bus in a specific zip code, we email all of them that are located in that area. But we can definitely include the community board. For example, this Saturday and Sunday, we'll have a combined vaccination and testing site at Mitchell Square, which is in the area here, with boosters and testing. And just like, I think it's important to mention, from now on, every time we have one of those vans out there giving vaccines, they will also be doing testing. So we're going to combine in the same place. They can do both. So if you see a vaccine, if you see one of those vans in the street, they, except if they're doing in schools, they are doing testing as well. And the same with all our mobile locations. So that's good to know. I think someone brought that about, like, testing and the demand for testing in the area. So this weekend is when we start doing vaccination and testing combined in the mobile clinics.
Well, do you have a flyer for the Mitchell Square will be when, Saturday?
I will send you everything by email. We just sent an email blast actually today, but I'll send it to you, all the information. It's from 8 a.m. to 6 p.m. It's vaccines for 12 and older, but I will send you all of this by email.
Very good. Yeah, but put it, we have 4 zip codes, 32, 33, 34, and 40. So,
yeah.
So put us down for all 4 of those zip codes. And you should include our district manager and our assistant district manager, and I'll forward you. Well, you should now have Paola Garcia's email because she sent you the link for tonight's meeting. But we'll send you Ebenezer Smith's email address as well. So we can regularly be in contact with you and help you publicize everything you're doing. The idea of doing both testing and vaccination at the same time, that makes a lot of sense. Avoids a lot of confusion, you know. So now if you see something, you know whether you want to be tested or vaccinated, you can go to it. Sally, you have a question or a comment?
Yeah, just reflecting some of the comments that are in the Q&A. It seemed like when they rolled it out to the kids, you know, there was a van down at Payson, but there was no follow-up. And given that we're looking at 2 doses for most of these things, I'm wondering why the city is scheduling a van for an initial shot and then you're sort of on your own trying to arrange your second dose.
So we started this 3 weeks ago, or a little over 3 weeks ago. This was managed by the Department of Education with the principals. And now we're coming back to the schools to do the second dose. If it was inside a school, we're coming back. Like this week, I was in a lot of public schools. This morning, I was in one. Tomorrow, I'm going to be another one. We're like making sure that everything is running smoothly. So we are coming back for second doses if it was inside a DOE, a public school, or some charter schools that also partnered with us.
And what about if it wasn't in a school? Like we had a van at the Payson Playground. Are you considering coming back to those locations where people got their initial doses?
What we can do is, and the reason why I'm here is also because of that, like we can partner with you all more, and then we can schedule specific vans depending on the demand. Or if there's a community event that you think is going to be a lot of people, that you think, you know, there will be, you think there are going to be some demand for testing and vaccines, you can ask, and then depending on availability, we can send a van there. This one, for example, that is happening Saturday and Sunday, it was a request from the Uptown Dreamers organization and the Black Health requested to do it there because they wanted to do another round in that location. So we can could discuss and then maybe plan and schedule future locations that you guys think it's needed.
Okay, and let me tell you, Uptown Dream is the guy who's in charge of that group is a neighborhood hero. So that's a good group to be partnering with, and I believe he's done a very good job steering people to get vaccinated in the community.
Coach Dave.
Coach Dave, yes. We can tell you plenty of stories about Coach Dave. We don't have time for any of them tonight. Are there any other questions or comments? All right, well, this is great. Well, Fernando, I think it's great that we have now connected with you and and establish a relationship so that we can help you promote what you're doing and maybe help steer you to locations where you can provide the vans in the future. Frankly, I thought putting the van up at Payson Playground on Dyckman Street was a little bit strange. It's sort of off the beaten track. There isn't a hell of a lot of pedestrian traffic there. I don't know how well that van did, but in my mind, that was I would have put it over on Broadway or someplace else where you would presumably draw more people.
I actually have another question, Steve.
Okay, well, I was only killing time because I knew you had another question.
Okay, good. Now that it's winter, I mean, with the vans, people are basically getting their shot and they're waiting their 15 minutes outside the van, or they're waiting outside the van to get their shot. Now that it's getting really cold outside, that seems less optimal. So are we looking at indoor sites?
So what happens now is after the vaccine, they wait the 15 minutes inside. We know that can create a problem, like you said, for people who are waiting to get their vaccine or their test. So we're trying to find locations that may have an area also for staffers to use bathroom, and also that may have a room or a community center that we can use maybe for the waiting area or for the lines, like we're doing in schools, for example. So yeah, we're thinking about that. There are some places that we're taking the big bus. The big bus has more area inside for people to wait. So we're adjusting a little bit based on the weather.
So if we have ideas of locations that are inside that have community space, we should direct them to you?
Absolutely. So my team is outreach team. We do is partner with communities because you guys know better about your communities and where to go and when to go and who to invite. So you can definitely send us some suggestions, some ideas, and then we check if we have available, and then we can send.
Great, thank you.
Sure.
Yeah, I'd say the last time I spoke to Coach Dave, he told me how he was trying to get access to use the Malcolm X and Betty Shabazz Center at which is 1 block south of Mitchell Square.
Yeah.
So, actually, maybe that's why he's arranged to have the van at Mitchell Square, because maybe you're also using that. Maybe you're using the Malcolm X and Betty Shabazz Center as an indoor site as well. All right, I don't see any other hands. So thank you very much, Fernando, and please stay in touch with us.
Thank you for the invite. I think there's still some questions in the Q&A. I don't know if you want to send me and I can respond, or
Hold on a second.
there may be comments.
Oh, okay. So Allegra is, I guess, correcting me about Payson Playground and saying that the van had after school and weekend hours, and which was good for parents who have to work for a living. And she says the van did okay, but would have been done better with proper advertising. All right, so we're going to help in the future to do that, to help with the advertising. Okay.
Thank you again for the invite. Thank you, everyone.
Okay, very good. All right, take care. Good luck to you. All right, next up is Ross Frohmer, Vice President for Government and Community Affairs at the Columbia University Irving Medical Center. Mr. Frohmer, thank you for sticking it out with us.
My pleasure, Steve. And I'm here tonight for in place of Janelle Edwards and Sandra Harris, who both had last-second conflicts. So I apologize. I tried to put this together, update at the last second. I do not have slides. I don't know if that's a good thing or a bad thing, but just a couple of things I want to go over briefly. In terms of the COVID numbers for Columbia University, last week, our testing positive results were 0.3%. That's less than, I think it was 38 positive cases overall. In terms of vaccination, for both researchers, faculty, staff, and students, we are at 100% compliance at this point. We do have a very limited number. I think it's under 100 medical exemptions. Again, that's entire university wide. Of course, there is concern, as mentioned, the Omicron. As far as I know, we have not seen any cases at Columbia. Those 5 cases seem to be elsewhere in the state. I can tell you that the numbers that I've seen show that there's a lot greater reason for concern in general by COVID in other parts of the states, and especially Western New York. So we're certainly keeping an eye on that. I think Pauline mentioned that Dr. Bassett is now the New York State Health Commissioner. As many of you know, Dr. Bassett is a VPNS alum, also alum and former faculty member of the Mailman School of Public Health. I can also mention that the new HHS Region 2 Director is Dr. Dara Cass, who up until recently was a member of our emergency department. So she has left us to go run HHS's regional office. Steve, that's all I got in terms of COVID. I have some updates on some other topics which I can do or not do, depending what you prefer.
Go ahead. I mean, I assume you're not going to take too much time.
No, I'm going to try to be as quick as I can. Let me just see. A couple of weeks ago, we dedicated our new dental van, which will be around the community, providing oral health services throughout northern Manhattan. This van is bigger than our old one. It has much better disabled access than our old one, and frankly, the motor works a lot better than our old one. This is a partnership that we have entered into with Delta Dental, so that you'll start to see the new van in and around the community. Last week, we had the Dyckman Scholars presentation to the full board. We had all 4 of our scholars attend, all 4 very impressive young people from this community. I'm pleased to say that 2 of them wanted to go on to graduate school in the health sciences. We are continuing with our toy drive and our food drive this year. I'll be honest up front, our numbers, the amount of food we're going to be collect and toys we're going to collect are going to be less than pre-pandemic years because we're not doing our normal holiday social events, which were sort of our main point of collecting toys and food. But we certainly are going to continue making cash donations to various food banks throughout the community. And I think that's it as I look through my notes here. Oh, there was one question in the chat. I believe it was Ms. Legrande as well. Apologize if I'm pronouncing that incorrectly. About ongoing studies at Columbia. I don't recognize the study off the top of my head. I can say that if you just Google Columbia Recruit Me, you'll be able to find all the ongoing studies that are recruiting participants at Columbia. And if you'd like, you can contact me offline or email me, and I'd be happy to look into this one further.
I did try to reach the woman who posted the announcement, and I think whose name is on the flyer. I think it's Nadia Nagoyan or something like that.
Nadia Nguyen.
Yeah, and I hope she returns my call because I am very curious about the study. I don't take the same position Allegra takes, although I understand where Allegra is coming from. But I would like to know why people are so hesitant. What is the reason? It sort of boggles my mind why some people are absolutely refusing to take the vaccine, even though it's for their betterment. So I would like to hear when they conclude that study. I'd like to hear the results, the findings. So I would like to have her come to the committee at some point.
Okay, Steve, if you just follow up with me or ping me tomorrow, I'll make sure to reach out to her directly.
All right, great. But I understand Allegra's concern, as you can see in what she posted in the Q&A, is that we're offering to pay these people to hear their side of the story. So it seems like we're giving them some incentive to continue to be to resist having the vaccine. But I don't know. We could pay them and maybe have a chance to convince them why they should get vaccinated. I somehow hope that might be the end result.
And again, I can't say I'm familiar with the specific study. All I can say is, if we can find out why people want and don't want to get the vaccine, I think that can be useful knowledge.
Yeah, I agree. Okay, very good. Thank you, Ross. And
pleasure.
You didn't mention that Community Board 12 was represented at the dedication of that dental van, but I will not.
That is true. Your chair was there, and it was an honor to have you there. So it was nice. I should also mention that we had 2 very nice events in Haven Plaza. We had an Autumn Fest a couple of weeks ago, and then we had our Holiday Haven, our Winter Haven last night, where we lit up the plaza with holiday lights. And Rabbi Yudi Shmatkin from the Hamilton Heights Chabad, Washington Heights Chabad, came by, and we lit Hanukkah candles as a group, and it was a nice little event. And Community Board 12 was also represented there. Mary Anderson joined us last night.
Yeah, I know that she was a little upset that the weather held her back the day of the dental van event, and she had wanted to be there as well. All right, well, thank you very much, Ross, and thank you for filling in for Sandra and Janelle. You did a respectable job. Okay, next from New York Presbyterian Hospital, Julio Batista, the Government and Community Affairs Liaison.
Hi, Steve. Good evening, everyone, committee members. I would sort of verify these numbers, but just to let you know that New York Presbyterian has vaccinated over 50,000 community members from the 4 local zip codes that you have mentioned. But I guess, I mention every time that it's really best to go to the New York City website to get that sort of overall picture of how many, what's the percentage per zip code that have been vaccinated. In terms of our patients, we have currently 140 patients in the hospital that are being treated for COVID. 22 of those patients are at an Uptown campus as of today. Consistent with the citywide trend, we have seen a small but steady increase over the past couple of weeks with these cases. With respect to capacity, at the COVID peak, we had 2,500 patients. Last winter, we had about 1,000 patients in-house. So we're prepared to adapt in the event of any other increase that we may get this winter. With regard to limiting elective procedures, we are following the state's guidance in the executive order and their directions on when and where we need to limit elective procedures. We currently, as of today, are not limiting elective procedures. We'll continue to closely monitor the situation. As everyone knows, the virus is hard to predict, and situations will continue to remain fluid. At this point, we're not limiting elective surgeries at New York Presbyterian. I'd just like to thank Steve. He joined the Northern Manhattan Agenda Mental Health Subcommittee that was chaired by Charlie Corliss at Inwood Community Services. And at that meeting, he did ask that yesterday that if we could provide some numbers on the psych beds. We'll soon be able to provide that to you. But I just would like to reiterate that we do continue to be to provide the very best inpatient and outpatient behavioral care to our patients. We are one of the largest inpatient mental health care in the state. We continue to care for these patients and invest in the programs while also maintaining the flexibility that's needed to fight the COVID. As we noted yesterday, Steve, at that meeting, Dr. Ng did report that we continue to work with our community providers, those who are not necessarily affiliated with the hospital, to work together and enhance those community mental health services program and services. So we're doing that. One of the programs is with Metropolitan, as Dr. Ng reported. Just a couple other things to add is that we had our annual Thanksgiving drive. At Columbia, we collected 250 bags of food for Thanksgiving that was prepared, and that was disseminated to a community through El Nido. We had another 100 plus from the Allen Hospital that went through Coalición Mexicana, and they distributed to some of their participants. One of the things that Ross had failed to mention, but I'm glad that he left it to me, is that the Medical Center Neighborhood Fund will start issuing their 2022 RFP. So if you know of any groups that may be interested who are within the confines of Community Board 12, meaning north of 155th Street, south of 220th, we would be happy to provide them with the RFP. Happy to say it handles by Janelle and Ross's team, and they also have that on their government and community affairs website, information on that. So a lot of work goes into it. Thank you, Ross, and your team for handling that aspect. And finally, I'd just like to give a big thank to Hebrew Tabernacle. As you know, the city is facing a blood shortage. They are hosting a blood drive on Thursday, December 9th from 2 to 8 p.m. So I encourage this committee to please share the word, with community members that, Hebrew Tabernacle is having this drive, and ask people to, if they can, go there and, support.
Why don't you, if you have a flyer about the blood drive, please send it to Ebenezer and Paola and ask them to send it out to our email list.
Yeah.
Can I just go back to the numbers again on vaccinations? Did you say it was over 50,000?
Over 50,000 for the 4 zip codes.
No, that can't be. That must be for the 28 zip codes.
For which zip codes?
That must be for the 28 that were used for the as a catchment area.
Well, that's when I started. I meant I'm going to confirm, but the numbers are given by data folks was that for a 4 zip codes was 50,000. So, but I'll check that to and confirm that.
Okay, well, if that's true, that would be fantastic. I mean, I checked with the Northern Manhattan Improvement Corporation hotline. And, not that everybody would go through the hotline to get a vaccination from the hospital, but the numbers from our 4 zip codes are maybe they're less than 15,000.
Well, I'll reconfirm it, Steve.
Okay, all right, but that would be useful. Yeah, and again, of course, we're interested primarily in our own 4 zip codes. So, right.
Can we get this data by month? Because you're talking about 50,000 since the vaccination was available, right? Would make sense.
Yeah,
that goes back to the beginning.
Right. So,
so let me quick question. I mean, if you're looking at what the overall picture of vaccinations are, there's a lot of other folks. For example, I got my vaccination. I didn't get it at the hospital. I got it at a pharmacy. So, the hospital won't have that information in terms of those community members who are getting vaccinated elsewhere. So if you want to get a global picture, you have to, perhaps, look at the data by zip code that the city may have, Department of Health, to see those data, because you're not going to get an overall picture.
I understand.
I have that data, and the total, as of today, the total number of people in the 4 zip codes who have gotten at least 1 dose, 148,656. And people who have been totally vaccinated, 134,115.
Okay.
So, I mean, if you did 50,000 of those, I don't know, I guess that's pretty good. But I actually thought you might you might be responsible for doing a larger percentage, but maybe not. Okay.
I'm sorry, I need to run. I just want to wish everybody a good week.
All right, thank you, Ross.
All
right. Sally, you have a question?
Yeah, I guess my question that I always ask, which is what's going on with Allen, is now irrelevant because you can hold this capacity now for COVID, given the governor's order. My question today is what's going on in the emergency rooms in terms of when I have conversations with emergency room doctors, they say they're seeing sicker patients across the board, and especially with the psychiatric. So I'm curious about what you're seeing in the emergency room versus what you saw during COVID. I'm also interested in an update on what's going on in terms of the nursing shortage.
Well, I could speak to the emergency room situation. I mean, on my computer, for example, like when I log on, it tells me where, I get sporadic updates, and, I constantly get updates saying that capacity of emergency room is pretty high. The census are very high. That has continued to be the case. While I was on, the Zoom here, I did again got an update saying that, the census continues to be very high at the emergency rooms. That has not abated, not just because of COVID, but because of other illnesses.
Right, they're now getting treated.
Yeah, so that, census is very high at the emergency rooms, both at Columbia and at the Allen.
Okay, and then as far as nursing, what's going on with losing nurses?
I can speak about what the nursing. I mean, I could try to find out in terms of details of staffing and how it is, but I have not heard of of the hospital having a a problem with the staffing of the nurses.
And one of the questions here in the of the 140 patients who are now being treated by the hospital, is there any chance of getting a breakdown as to how many of them are unvaccinated?
I will inquire to find out if that I could get that specificity of the patients, percentage at least of that we have in terms of how many of them may be unvaccinated. Or I'll try to get that.
Because the person making the inquiry is saying that there are a lot of breakthrough cases, which I don't know. I haven't heard that. They seem to be pretty rare, but not that it doesn't happen, but certainly doesn't seem to be commonplace.
I concur with that. I think a lot of the patients, a lot of the cases are, patients who have unfortunately have not gone out and got vaccinated. We still have a lot of patients and a lot of people in New York City who are not.
Yeah, that's what I hear as well. But it would be good to get real numbers if you can. Okay.
Oh, Steve, sorry, I just wanted to hop that we do have information on the city's website, not code specific, but I think overall cases and death rates, and it is sorted by vaccination status. So there is overwhelming data to show that being vaccinated does prevent cases and deaths. Of course, they still happen because, the vaccine does not necessarily stop transmission, but do have actual data showing that people have better outcomes if they're vaccinated.
Well, we were never told that the vaccinations are 100% effective.
Right.
We were told that they were, 90 or 95% effective. So undoubtedly, somebody who gets vaccinated somewhere along the line is going to get sick. It's not 100%. There's no 100% guarantee. But the real problem that's being faced across the country is the fact that people who are not getting vaccinated for whatever reason are ending up getting sick, ending up being hospitalized, and unfortunately, some of them end up dying. And that's the real problem. The problem is not with people who are getting vaccinated. Okay. All right. Well, that's my 2 cents. I think we covered it, Julio. And again, let me just make one more statement, which I think we've made maybe ad nauseum. But the institution may believe that you're taking care of all of the psych patients, but somehow, if you don't have those 30 beds, and if you don't have the beds that have also been closed at, I believe, Brooklyn Methodist, there are fewer beds available in your system. And it's still, I think, a puzzle to us as to where those patients are going. If you're not taking care of them within your system, where are they ending up? They must be going somewhere. And at this point, as Sally mentioned, there's probably a higher incidence of psychiatric problems than during normal times.
I just want to say, our patients, if they require inpatients, we do have facility. We do have the Westchester, who, and as Warren mentioned, additional 5 beds were built for, CHONI patients. So we had the additional 5 beds at Westchester, and we also have Gracie Square Hospital, which is on the 70s. That it's solely dedicated to mental health. So, when you say that they have nowhere to go, there is capacity within the New York Presbyterian healthcare system where they are treated.
All right, but again, the system as a whole has eliminated, I guess, 80 beds. So there are 80 fewer places where you can treat people. But you may have just passed over this thing, which people should take note of. There are now 5 adolescent psych beds, but not at CHONI. They're in Westchester.
They're in Westchester, right? Yeah. Yeah, we still continue to operate the Milstein Psych unit, which is for adults. But 5 additional beds were created for adolescents for Morgan Stanley Children's Hospital at the Westchester Division.
And there was just a report that came out that talked about the crisis in child adolescent psych.
Mhm.
And how many adult beds do you have at Milstein?
I believe it's 30 beds at Milstein.
Also, okay.
So when you say 5 additional, how many total then? Additional to what? That's my question.
I think those are new beds, aren't they?
These are new beds.
Okay, so it's not additional. This is the 5 beds. Because when you say additional, I look at it as like, oh, in addition to X.
Right. So I don't, so I don't have the number top of my head of how many beds we have in Westchester. But whatever we had, we now have, in addition to those, 5 additional ones that were.
Can you find out how many total then?
Sure.
In Westchester?
Yeah, sure. Well, I did mention to Steve that he wanted to get the numbers of beds in total. So we would, when I present that, I'll include that as well.
Like by facility, by a hospital, not total for the entire system.
Yes, yeah, that would be good. Yeah, very good, OC. Yeah.
And if we could also get the discharge data in terms of where the ER psych patients are going, how many are going to Gracie Square, how many are going to Westchester, and how many are going to city facilities?
Okay, well, so I'll see what data we can provide, Sarah.
All right, that's good. All righty. All right, thank you, Julio. Okay, we're up. Oh, by the way, oh my gosh. One reason that the census at the ER is doing well tonight is one of our committee members is there, Betty Lehman. So she doesn't want me to tell you this, and she tells me she's getting good care there. But maybe you could have somebody check up to see how she's doing. Apparently,
so Steve, maybe we could talk offline about that.
Okay, very good. Okay, yeah. I'm sorry, I shouldn't have brought that up.
Yeah. Okay.
I'm sorry. Okay, that was a mistake. Okay. Oh gosh. Okay, we're up to old business. DEP service requests. The latest report for the November on the complaints and service requests generated from people in Community District 12. The top 4 complaints are all noise related. Noise from construction before and after hours, 91 complaints. Noise from construction equipment, 29. Noise from alarms, 10. And noise from private quarters, another 10 complaints. So a total of 204 complaints, and certainly more than half of them are noise related for the month of November. The other report, which I forwarded to the committee members from the Department of Design and Construction concerning the gas and water main work going on in the community, they have now reached the 91% completion level, and they're hoping to complete the entire project by early January. The street and sidewalk cleanliness ratings were not posted on the website. Is there any other old business?
Yes.
Ms. Kamina.
Yes. Do you have any update about the textile recycling? When are they coming back to our district? And so this is one thing. The other thing, do you know anything about it, Steve? Do you have any information? Unless Sally, I think she's raising her hand. I don't know if she can answer that.
No, I was afraid you were going to ask that question, and I didn't get a chance to check into it, but I can do that tomorrow.
You were not afraid enough because you were not prepared for an answer, like to answer that. So, my other question is about didn't we speak about inviting a representative from the Department of Health, the State Department of Health, to talk about the actually maybe Julio can provide it next month, to talk about the vaccination rate.
The vaccination rate?
Yeah, I'm sorry, the number of people that got vaccinated at the Armory. And my last thing is not an old business. So that's my old business.
Well, my understanding is that Julio will be giving us the numbers as they relate to our 4 zip codes of the people who got vaccinated at the Armory.
That would include those numbers, yes.
What do you mean by include those numbers? Are there any other numbers from something else, from another facility?
Well, we're also vaccinating since we closed the Armory. We're doing vaccinations at the Morgan Stanley Children's
Okay.
Hospital.
All right.
Right.
Okay.
And aren't you also doing vaccinations at the ACN sites and elsewhere? I mean, all of those numbers should.
Yeah, I'll collect all those numbers from the data folks.
All right, very good. All right, Sally, is that a new hand?
It is. We still have to talk about that $10,000 for the environmental NYC cleanup. I'm wondering if there's any progress. I know it came up at one of the executive committee meetings, but I'm wondering how we can push for that to be used for what it's intended, and also how we can schedule those e-waste recycling events with Lower East Side Ecology Center.
Well, I brought it up again at the last executive committee meeting, and Eliezer says that we're going to have some kind of a vote on it. He's going to apparently put together a list of possible ways in which the money can be spent. And it looks as though at the point in which we will be voting on it, you're going to have a vote. You'll be a member of the executive committee. So,
okay, I just want to make sure that they understand that the intent of that money was an environmental initiative.
Well,
it's not whatever anyone decides they want to spend it on. And then I have a second item that I wanted to bring up, and I'm not sure if this is, I guess this is new business.
well, we're not up to new business yet.
Okay. But I just want to make sure that that environmental money is not, it's not a free for all. How would you spend it? This is New York City NYC cleanup funds that are supposed to go towards the environment or the environmental committee. I'm not sure why there's much discussion.
All right, well, we're going to work on this together when you become a member of the executive committee, which is not that far away. Okay, any other old business? Okay, we're up to new business. OC, hold it. OC had an item of new business.
Yeah, trauma center. So I know, I mean, I will try to find out. Okay, you want me to find out who from the, who can come and talk to us about that from the state level, I'm assuming?
Well, I don't know. Julio, do you know who, which entity is in charge of designating the trauma centers? Is that done by the city or the state?
No, it's done by the state. I could certainly find out for you which division of the, unless Pauline knows, but I could find out from folks who's the entity responsible for designations.
Yeah, would appreciate that. So we need that bit of knowledge first before we can go any further. So OC, let's discuss this more.
I would like to have that an agenda item in one of the very next meetings. So we're gonna have to start inviting people to talk to us and see how can we go about that.
Yeah, yeah.
Yes.
Okay, I agree with you. I want to pursue it, but there's a way to do it. Maybe let's talk later on about it.
Okay.
Sally, you have new business?
Yeah, two things. One is, I think it would be nice if we could invite Dr. Bassett to one of our meetings now that she's our state health commissioner. And second, we're an environmental justice area in Inwood, and we don't, as OC brought up, we don't really talk much about environmental impacts, but we need to start considering this as an environmental justice area. So I wonder if we could have a presentation by someone who's on the designation of environmental justice area, what it means in terms of how we consider proposals coming before us.
It's okay by me. If you let's give it some more thought as to who could be invited to do that.
Okay.
It
could be someone from WEAC, because I know they're on the advisory committee for the Office of Sustainability or whatever that's called.
Right. No, unfortunately, they lost one of their key people in this area, who used to come to our meetings, in fact. Tanya.
Yes, I was wondering, kind of almost what, going further with what Sally was saying about us having, as part of the new year, some focus on environmental issues and environmental justice. And I was thinking, because, I know that this administration that's outgoing had an environmental justice advisory board, and they held a series of public hearings, as you know, about that, about those issues and gathering data and information. And perhaps, this committee, you, Steve, as chair, could invite someone from the new administration in the mayor's office to see what, to talk about, our, desires in terms of environmental issues and justice in our particular community, and like what the plans are to continue that work in their office, and how that's going to intersect with what we're trying to do on the community board or boards in this area.
All right, well, that's that gives me some good direction. So what I assume the new administration is going to keep that advisory board in place.
I hope.
I think it's a fair assumption to make. In the early new year, when presumably maybe there's a new chair or a new executive director, we'll reach out to them and try to have them come to one of our meetings. That's one way. That's one way.
Peggy Shepard is the head of that advisory board.
Oh, well, we can certainly invite Peggy.
Hi, this is Emily. Sorry, just I'm outside and it's kind of busy. I'm in the planning committee for WEAC for environmental justice, and they just had their last membership meeting on the second. Yeah, it's always on the second week of each month. So they just told us that they weren't going to be doing much till after New Year, but I can still get back to the people that work there and let them know.
I'm sorry, you were fading in and out there. So Emily, what is your role at WEAC? Say it again.
Sorry about that. Can you hear me now?
Yes.
Okay, so I'm the chair of the planning committee.
Oh my God. Oh.
Yeah. The only reason I didn't talk is because of the sound issues that I have. But yeah, I'm part of the planning.
So we have a direct link there.
And we just had our last membership meeting of the year. So we aren't going to be doing much more planning. But I could still have a chat with the organizer, because I'm only in contact with the director of organizing and a couple of other members, but I can just let them know.
Okay, well, let them know that we're open to hearing some ideas and getting some presentations on environmental issues. And let's see if they can suggest something that we can add to our agendas. So I'm going to count on you because you are a direct link to our local environmental organization. So this is great. You're a great pickup for the committee.
Yeah. So I'd be happy to, certainly.
All right, great. Let's stay in touch, because I never expected health to dominate the committee's business as it has, and certainly over the last 2 years. But I think events have driven us in that direction. But we certainly I certainly had no intention of ignoring environmental issues, and we certainly have had some environmental issues on our agenda, and we should continue to do so. Julio, Is that your hand?
It's a mock. It's not really my hand, but
Not your hand.
it's
Okay.
an animated version of it.
Okay, great. Sally, is that a new hand or the old one?
Oh, that's an old new hand.
It's an old new hand. Okay, well, that's how we think of you, as an old new hand. Is there any other new business?
So
Now that's a real hand.
that's a real hand, yeah, because you ignored my animation one. Just wanted something that's not hospital related. On next Thursday, the 9th, from 5 to 6 p.m., the Duarte Triangle will have its first annual tree lighting ceremony. That's being put together by the Juan Pablo Duarte Foundation, Cynthia Ravelli, and the Washington Heights Garden crew, along with Cloth. We'll be hosting that next Thursday, December 9th, 5 to 6 p.m. I'll have them send an invitation to Ebenezer. You can circulate it to the team.
Very good. And I'm sorry, did I already tell you to send an invitation about the blood drive at Hebrew Tabernacle?
All I have is really an email, but I'll compose something that Ebenezer could mail out.
Yeah, very good. All right, yeah, please do that.
Yeah.
Okay, I can't imagine that there's any more new business. Okay, very good. Under announcements here, I put down the Grow NYC has reopened or has opened up some food scrap drop-off sites. They just opened one at 181st and Fort Washington on Thursdays from 7 a.m. to noon, and there's still there's one at the Inwood Green Market on Isham Street Saturdays 8 a.m. to noon. And
Steve?
Is that who's that? Tanya?
Yeah, I'm sorry. I didn't mean to cut. Did we skip the corner project? That's new business.
Oh, damn it. Yeah, thank you. Yes, so my intention is to invite the corner project to the next meeting so that we can have a full discussion with them. It wasn't possible to get them for tonight, but I think there's an upside to that because we'll be able to see how it's been operating for a month and probably have more to discuss at that point. It won't be theoretical in a month. It'll be something that's real. So we can see if it's had any kind of impact on the community or what that impact might have been. Pauline is going to get us somebody from the Department of Health who's in charge of the overdose prevention centers. So we can also hear from the city agency in charge of this initiative.
Steve, Allegra raised her hand. I don't know if you can, I don't know how to.
Sorry, who raised her hand?
Allegra,
Uh,
she's raising her hand right now. I can see it, but I can't do anything from my end.
Well, I don't know how to recognize her at this point.
If someone can promote her from the board office.
All she has to do is unmute herself.
Steve?
Yeah, Allegra's now on.
Oh,
Steve?
Go ahead, Tanya, sorry.
No, I was gonna say I just wanted to mention, there's just some language in the chat that I just don't, referring to things as shooting galleries. I just don't, I understand that people have concerns, but might have concerns about this particular initiative and what it might mean, but we can't dehumanize people who might be needing these services or might end up using these services. I just wanted to say that because it's just kind of like languages I just don't like.
Well, again, I think one upside to not having the discussion tonight and having it a month from now, when we can have the people at from the corner project present, as well as the city health department, is that we can have a discussion based on actual facts and knowledge and the experience of seeing what's going on there over at least the first month. So rather than just talking about it and maybe in an emotional way, we can talk about it in a factual basis.
Yes, I just want to correct BG. This is a disease called substance use disorder. These are not shooting galleries. I find this language offensive on our chat. I find it offensive on Facebook. I wish you would cease.
Okay, I think we agree with you. Allegra, did you have a comment?
I had, you were asking about new business. I had two things I wanted to say. One, I had asked before about getting, Columbia has an NYC Ticks group, and now they have a Lyme specialty group. I think it would be nice if we had somebody from either Maria Fernandez's Lyme group or Brian Fallon's Lyme group at Columbia that came and gave a talk. You have to, they're researchers, they have funny schedules, but that's one thing. And the second thing is that the DOT has just released its streets plan. And in there's some projects, a quote unquote green wave corridor that some places are going to be getting, including Inwood. If you search the document, it is labeled in the map and nowhere else. I have no idea what it means. It would be nice to see, like maybe with the woman from We Act, whose name, I'm sorry, I'm bad with names. Maybe she could follow up on that, or get somebody from DOT to come and tell us like what exactly that streets plan, if there's some environmental justice things going to be going on, expansion of greenways or bike lanes or whatever.
Well, this may be something we should look into jointly with the
yes,
with our transportation committee.
Yes, exactly.
So I thank you for pointing that. I'll be looking into that. But can I go back to your first comment?
Sure.
I didn't quite gather what it is. Did you say Line, L-I-N-E group?
No. So Columbia has had for a while an urban tick research group by Maria Fernandez. She's a researcher at Columbia. They have just started, as in like in the last couple of months, a Lyme, as in the city in Connecticut, which is the nasty disease, tick-borne disease, Lyme.
Oh, Lyme. Yeah.
Yes, they have started a specialty Lyme unit, and they're one of the first like tier 1 research university to have like this kind of thing. They're interested in patients and Lyme disease and other kinds of tick-borne illnesses. But I think it would be nice if we could get somebody from those groups, and they have Brian Fallon is the head of that group, but obviously they have postdocs and subdocs and research scientists and PhD students. They have their groups. So maybe somebody from each of those groups could come. That would be, I think, nice.
All right. Well, do me a favor, if you don't mind. You have my email address. Could you just give me a couple of sentences that I can forward to Ross? This seems like this is a topic we've never looked into before. So it seems like something we should do.
No problem.
All right. Thank you, Allegra. All right. It's almost 9 o'clock. Is there any other comments or questions? Okay,
I'd say, Steve, you handled the agenda very well. It was a lot and you got through it, and it was good timing, I think. Not bad.
Well, I tell you, it's all,
as always.
It's all worth it if I can get a compliment from you, Tanya. Okay, Emily, I hope you enjoyed your first meeting with our committee, and I hope you're going to stay with us.
I definitely did. Thank you so much. It was very informative and productive. And all I have to do is just sign up again, fill out the application again, because I think I'm filling in for someone.
No. As far as I'm concerned, that's not my understanding. But if that's the case, I'm going to be very upset. As far as I'm concerned, you were given a lifetime appointment. So I don't think it's
oh, yes.
I think you're stuck with us now. So thank you very much. And we're going to adjourn this meeting at 9 p.m. And thank you all for coming. Thank you, Julio, for sticking it out. Thank you, Pauline, for staying with us as well. And to all the people in the chat or whatever it is, Q&A, thank you all.
Thank you, Steve, and happy holidays to everyone.
Yes.
Bye, everyone. Bye.
Bye, everyone.
Happy holidays, everyone.